to a relatively peaceful Ghana. And I just have to add that the highlight of my tenure as Girl Senior Prefect in 1964, which you mentioned, was the encounter with Muhammad Ali, or Cassius Clay, as he was then known, heavyweight champion of the world. As Girl Senior Prefect, I presented him with a bouquet. He bent down almost double and kissed me on both cheeks. For a 19-year-old at the time, that was huge. And the confession I have to make is that I did not wash my face for 1 week. I haven't told many people this, but today I think I should let it out. At this time, I would also like to take the opportunity to congratulate the President of the OAA and the Executive Committee for the brilliant idea of the Achimota Speaks symposia on issues of national interest and importance. I feel greatly honored by the invitation to be part of this process. And hopefully the ideas generated here and in the previous sessions will translate into positive efforts to advance our still evolving national and political development. Mr. Chairman, I've been asked to speak to the theme, Client Services in Healthcare Delivery in Ghana, a valid expectation or a luxury demanded. In other words, is quality healthcare in Ghana an inherent right that all its citizens are entitled to, and which therefore ought to be it or its privilege, or is it a privilege? And if a right, then there are obligations of the state as duty bearer to ensure quality services, and for the populace as rights holders to claim these rights. Also, if a right, then we should have a say on how these services are delivered. The philosopher Lucius Annaeus Seneca declared that health is a soul that animates all enjoyments of life, which fade and are tasteless without it. Health is a soul that animates all the enjoyments of life, which fade and are tasteless without it. And the attainment and maintenance of good health, therefore, should be a must for each individual as well as for the collective community, for personal and national development and prosperity. Indeed, the motto of the Ghana Health Service, our health, our wealth, well captures this aspiration. The right to quality health care and the fulfillment of that right is therefore an obligation that requires commitment by government for its execution using various policies and strategies and with the requisite resources. My presentation will be in 3 main parts. The first part will explore what our understanding of health care delivery should be and establish this as a right. I will then outline the expectations or entitlements of these rights and the realities and some of the challenges inherent in a developing country like Ghana. And finally, the opportunities and suggest some requisite strategies looking into the future. I'll also attempt to make, hopefully, to make what could be a rather staid and technical treatise into what I hope will be an enjoyable and stimulating talk for all of us. Health is always such an emotive subject and also highly politicized. As we can see from the ongoing US experience with Obamacare and Trumpcare, witness also the perennial issues with the National Health Insurance Service of the UK, where politicians make commitments to or make promises to the populace about what they will do about health care. So what is our understanding of health? The preamble of the 1946 World Health Organization Constitution defines health broadly as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In other words, healthcare delivery is more than what most people generally envisage, which is curative care in hospitals. I would therefore refer to the concept of holistic health care and not just services in health institutions, because that is really only part of the story. And an East African adage says it all very well. It says, health is made at home. Hospitals are for repairs only. Frank P. Grady credits the WHO Constitution with establishing the right to health as a fundamental, inalienable human right that governments cannot abridge and are rather obligated to protect and uphold. The right to health, ladies and gentlemen, has also been enumerated in international agreements, including the Universal Declaration of Human Rights and the International Covenant on Economic, Social, and Cultural Rights, among others. The Universal Declaration also establishes a responsibility that extends beyond the provision of essential curative health services to tackling the determinants of health. The human rights to health, therefore, includes access to all medical services, as well as to proper sanitation, adequate food, decent housing, healthy working conditions, and a clean environment. Health and sanitation are like Siamese twins, conjoined at the heart. You cannot successfully separate the one from the other. There's also the important issue of unequal access to quality health care. Poor people are not receiving the same treatment as more financially fortunate. And I dare say that the lived experience of those of us in this room is completely different from that of our compatriots in other parts of the world, and sometimes even within the cities that we live in. And we are saying black, white, and heart. So forget about your genes. It is your zip code that influences your access to quality healthcare service. States have a special obligation to provide those who do not have the sufficient means with the necessary healthcare facilities and to prevent any discrimination on internationally prohibited grounds in the provision of health services. Mr. Chairman, also at the regional level, Article 16 of the African Charter on Human and People's Rights of 1981 affirms the right to enjoy the best attainable state of physical and mental health, and the obligation, again, of the state to take necessary measures to protect the health of their people and to ensure they receive medical attention when they are sick. And at the national level, coming home, Chapters 5 and 6 of the 1992 Constitution of Ghana set out the right to good health care, which has been interpreted by the Constitution Review Commission in 2011 as a positive recognition of the right to health as a full-fledged right enforceable under the Constitution. And now, with the establishment of the National Health Insurance Scheme, where people pay premiums upfront to guarantee services when needed, then expectations for quality delivery are very high. But other people have criticized the right to health. One criticism of the right to health is that it is not feasible, and that the financial and logistical burden of ensuring health for all are unattainable, or that there's no right to anything that others must produce, because no one may claim a right and enforce others to provide it. But in reality, the Ghana government, through its constitution and as a signatory to the aforementioned agreements, is committed to and has a duty to provide health services to its entire people. Mr. Chairman, health policy in Ghana over the years has been influenced by international and global initiatives and agreements. The Alma Ata Declaration of 1978 for a long time influenced our health services, and it reaffirmed the WHO definition of health and added, among other things, that the people have a right and duty to participate individually and collectively in the planning and implementation of their health care. So Charles, you should not be considered too known if you make suggestions to your doctor or your healthcare provider or even to government. Is Charles here? Governments have a responsibility for the health of their people, which can be fulfilled only by the provision of adequate health and social measures backed by the financial wherewithal, and requires the political will, and I'd like to emphasize political will, to mobilize the country's relevant sectors and resources, as well as any available external resources. So at country level, as I've said, we have these clearly articulated obligations. But as James Madison opined, the Constitution, and I hasten to add, agreements and laws and policies are of no consequence than the paper on which they are written on, unless they be stamped with the approbation of those to whom they are addressed, that is, the people themselves. We have to demand the right to quality services delivered in a competent, satisfactory. Mr. Chairman, to the question, what is the situation in Ghana today? What structures do we have in place to keep our people healthy and to deliver quality health services? But they say to know where you are going, it is good to know where you have come from. Mr. Chairman, it's of note that in the 1920s, Sir Gordon Gagisberg, one of the illustrious founders of our school and then governor of the Gold Coast colony, stressed the importance of sanitation, availability of potable water as important to maintain health. Under a law passed in 1925, teachers were required to be knowledgeable about hygiene and sanitation. Health days and health weeks were implemented in educational systems in order for students to focus on the importance and long-term effects of being healthy and maintaining good personal hygiene. So right from the beginning of our healthcare system, prevention of disease and promotion of health were deemed important. Fast forward to 2017, what do we have? Mr. Chairman, I was privileged during my tenure as minister, aided and abetted by Dr. Asamoah sitting here, to have the Ghana Health Service Act passed by Parliament in 1996. The Ghana Health Service is a public autonomous executive agency responsible for implementation of national health policies under the control of the Ministry of Health. An advantage of the new structure was to remove the service and its employees from the civil service control, and thus allow for a greater degree of managerial flexibility to carry out their responsibilities. These were necessary steps in establishing a more equitable, efficient, decentralized, and accessible, responsible healthcare system. Most healthcare in Ghana is provided by the government and largely administered by the Ministry of Health, the Ghana Health Services, and other agencies with 5 levels of providers, as some of you may know: health posts, mainly in rural areas, health centers and clinics, district hospitals, regional hospitals, and tertiary hospitals. And currently, there are just over 200 hospitals in the country. Then we have the 3 teaching hospitals, which are autonomous entities with their own governance structures, also under the Ministry of Health. There's also the private health sector. Hospitals and clinics run by the Christian Health Association of Ghana, or CHAG, provide important healthcare services, mostly in district capitals. Then there are the for-profit clinics and hospitals, but these make up less than 5% of general healthcare. Then, believe it or not, there are the alternate medicine providers, including traditional medicine practice, consisting of spiritualists, seers, soothsayers, herbalists, and the wanzams, or traditional circumcisers. It's estimated that about 50% of Ghanaians will visit a traditional healer as their first point of call. And for a vast majority of rural people, it is still their sole source of available health care. They are very organized, and they are there, and they are providing health services. As part of health sector reforms launched in 1988, we surmised that since the Ministry of Health is responsible for quality care of all Ghanaians, and not only those attending Ministry of Health hospitals, then the ministry had a national role to regulate and monitor the performance of other providers of health care. Mr. Chairman, with regards to the health workforce, the latest figures showed that for a population of 25 million or thereabouts, there are just over 2,000 doctors and 10,000 professional nurses. That is about 10 physicians and 90 nurses per 100,000 persons. Compare this to Sweden, which with a population of just fewer than 10 million, has 35,000 doctors. 35,000 as opposed to 2,000 for our population of 25 million. And their ratio of doctor to population is 300 doctors to 100,000. We have 10 per 100,000. And Sweden still complains of a shortage of doctors. Clearly, the work health force in Ghana is woefully inadequate. And how does Ghana rank in health service delivery? In a baseline analysis from the Global Burden of Disease study of 2015, which measured the status of healthcare of 118 countries that were assessed from all regions of the world, sub-Saharan African countries came right at the bottom. Ghana came in at 144 out of 188, but behind Botswana as number 133. South Africa, Namibia, Gabon, Djibouti, in that order. So in absolute terms, among African countries, we are not doing badly. We are in the first 10. But we don't want to be ahead of the bottom pack. We want to be with the best in the world. As they say, you don't win the silver, you lose the gold. You want to be there, right in front. And Professor Jimambadu Akosa, former Director General of the Ghana Health Service, in an interview on one of the FM radio's breakfast show, lamented that healthcare in Ghana, after 59 years of independence, was not worth celebrating, and criticized the government for failing to improve on preventive healthcare as well as curative systems. He also made reference to inadequate and overworked staff. Mr. Chairman, over the years, the Ministry of Health and the Ghana Health Service in more recent times have developed policies and instituted programs and strategies in an attempt to deliver better health care for Ghanaians. But clearly there is a lot of room for improvement. Also, over the years, we have come to understand better the role of all sectors of society in shaping our chances of a healthy life. And everyone has a role to play. Employers, educators, many other sectors of government, as well as ourselves, our families, and our communities. So what should we be looking for, looking into the future and starting from now? What is due to us as right bearers to quality health care? Predicting the future is always a difficult task. And in these days of internet, social media, and other phenomena like new diseases, environmental pollution, climate change, superbugs that are resistant to existing antibiotics, any prediction becomes almost heroic. But we know that the population will grow, that is a given. We know that Ghanaians will continue to grow with more absolute numbers of older people. This alteration in the demographic structure will be associated with more chronic, non-communicable diseases, while communicable diseases, both old and new, will continue to remain major causes of disease. With more people becoming better educated, hopefully as the current government has promised, expectations and demands for health services will rise. Media interest in health services, increasing foreign travel, better communications, improved information, and increased links with other parts of the world will introduce more people to standards and expectations taken for granted in other parts of the world. We may even look forward to distant consultation using computer and video images. And as somebody said, if you don't need to go to a shop to shop or to a bank to bank, why must we go to a health facility to get health care? You never know, it might be possible soon. So looking forward, we want a health service that would respond to the needs of the population and provide quality services. We want equity in healthcare, not only for the people in the cities. We want to see efficiency in the use of our resources. There should no longer be missing drugs or expired drugs that are burned, or broken down equipment due to lack of adequate maintenance. We should expect respectful services and shorter waiting times at health facilities, and services to be as close to people's homes as possible. We want the widest possible range of needs to be met through a closely integrated set of general health services. In other words, if possible, a one-stop shop. People would also want to have more specialist services close to home. At the moment, for the majority of Ghanaians, seeing a specialist means having to travel sometimes long distances from home. In order to satisfy these demands, the physical structures and equipment should be in place. The system should have adequate numbers of providers that are competent and up to date with modern trends in health delivery. And ancillary care and services provided by other paramedicals should be available. Patients or clients should be able to question and discuss their management with their healthcare professionals. After all, it is our lives. And drugs should reach every corner of the country. If Coca-Cola can be found in every nook and cranny in the remotest villages, so should drugs and other health consumables. Mr. Chairman, the implications of all these requirements are enormous. And to meet these expectations, there will be need for strategies for producing the requisite numbers and types of healthcare professionals able to provide these quality services. The health workforce consists of all people engaged in actions whose primary intent is to improve health. This includes health service providers such as doctors, nurses, midwives, pharmacists, lab technologists, and community health workers, but also health management and support workers such as hospital administrators, district managers, and social workers. And importantly also, it will be necessary to manage the human resource to ensure that they are retained in the health sector and deliver care to their maximum capabilities. Ghana, like many African states, has over the years established its own institutions for training health manpower. This has allowed, in many cases, for more custom tailoring of curriculum and has also reduced the cost of training and increased the workforce. But to meet the health needs of Ghanaians, it is necessary to markedly increase the number of health professionals to be produced each year. In some countries, the numbers have been worked out, and staff projections tend to be based on ideal standards of staff population ratios and norms. It is generally accepted or agreed by the international community that a doctor-patient ratio of about 30 doctors to 100,000 population is required to deliver quality services. By this reckoning, Mr. Chairman, Ghana needs 7,500 doctors to deliver adequate health care to its people. That means an additional 5,500 to the 2,000 we have for our current population. How do we get there? Also, there should be public health physicians and nurses to provide the promotive and preventive health care that should form part of any healthcare delivery system. All this calls for coordination between training institutions and the health system, as happens in the industrialized countries and which we can borrow from. And Mr. Chairman, doctors and health professionals, including nurses, pharmacists, laboratory and other technologists, however good and competent they may be, cannot work in a vacuum. They need the requisite infrastructure, hospitals, beds, and adequate working equipment, drugs, and commodities. These are a minimum requirement for providing health services. I now come to the all-important issue of financing for healthcare. The cost of funding healthcare in many countries is huge. It's a huge undertaking. In a country with a significant disease burden, Ghana's government health expenditure is relatively small at just under 7% of GDP. And this has led to substantial financial gap, which has fallen on the private consumer. The National Health Insurance Scheme, including the related health taxes, are helping to some extent to defray part of the recurrent cost, but this is still inadequate, and we are still in the woods, very much so. Funds are needed for manpower training and for infrastructure and equipment to deliver quality healthcare services. And I think that time has come to rope in the private sector more meaningfully. Employers, industry, and investors in financing healthcare to support the financing by government. But more importantly, governments must commit to allocating more resources for health. Ghana is yet to reach the 15% of GDP recommended in the Abuja Declaration of African Heads of State in 1999. We are still at 7. We're not even halfway there. So, Mr. Chairman, we, the people, need to make this an election issue and hold our politicians accountable to make good on it or vote them out. We have seen how President Trump and the Republican Party are struggling to put together an act to deliver an election promise on healthcare delivery. It's as important as that. Mr. Chairman, clearly there's been a great effort over the past couple of decades in terms of restructuring and policies and strategies by the Ministry of Health and its agencies. But have all these translated into improved and better healthcare delivery services for the average Ghanaian? or even for non-average Ghanaians like those in this room, is a system providing services that include the whole spectrum of promotive, preventive, clinical, and rehabilitative healthcare, and are services available, accessible, affordable, and acceptable? The answer clearly is no. Or perhaps, being the eternal optimist that I am, I would say, not yet. It is important for government to assess the impact of the progress so far made so we can strengthen our one step forward to ensure that we do not slip the traditional 2 steps back. We need to take stock of what we have and what is good in the system that we have. Mr. Chairman, there are some immediate concerns, and there are some low-hanging fruit that can be picked with the current resources available while we advocate for more resources for better services. These are mostly preventive and promotive services, which I will try and capture in age-specific brackets and very quickly. Immunization against the childhood diseases for children under 5. For adolescents and young people, the future leaders and the cohort for the demographic dividend of progressive national development, we need special care, especially comprehensive sexual and reproductive health services for them. Maternal health services need to be improved. No woman in this country should have to put her life on the line while fulfilling her natural role of propagating the species. Women should also have routine screening for breast and reproductive cancers, especially cervical cancer, at every opportunity. Older men and women should be screened for various diseases, including the common cancers like breast cancer, cervical, and prostatic cancer. Screening for diabetes and high blood pressure is also a must for all people over 40. We should aim towards establishing wellness clinics that emphasize health promotion and disease prevention by public health doctors and nurses. Mr. Chairman, I cannot end without reference to the latest global affirmation on health. In September 2016, the world's leaders at the UN General Assembly adopted the Sustainable Development Goals, or SDGs, which contain recommendations to advance the health of the world's peoples. And what the SDGs do, especially in our context, is to recognize the importance of quality health care and the fact that health challenges can no longer be addressed by the health sector alone. It emphasizes universal health care through the delivery of integrated, people-centered services that span the life course, bringing prevention to the fore while protecting against financial hardship in seeking quality health services. And the Swedish healthcare system most closely represents this state of affairs and provides equitable and quality health services to all people living in the country. Sweden's health budget is covered by a combination of funds from a health tax paid by employers and with adequate government subvention. And of the 30,000 doctors that I spoke of earlier, 70% are specialists in general practice and live in the communities. Primary healthcare units attend to all health services not needing advanced medical equipment, and there are referrals to hospitals as necessary. Public hospitals see patients requiring hospital treatment, and there are acute care hospitals which operate on a 24/7 basis. At the very top, highly specialized care is provided at 7 public university hospitals, all in a synchronized and competent manner. Ghana's healthcare service could benefit hugely by reviewing and adopting relevant parts of this strategy. In conclusion, Mr. Chairman, we cannot stop people from dying because death is part of the continuum of life. As somebody said, if you don't want to die, then don't be born at all. Don't allow yourself to be born. But we can aim at a quality of health and services that guarantees a high level of well-being throughout life and good quality services when we need this. Our aim must be to die old as young as possible. And it is the duty of government to ensure we achieve this by guaranteeing quality, preventive, promotive, and curative services that are available to all Ghanaians. And for this, we should demand political will and leadership at the highest level of the president of the state. Such leadership has been progress in health delivery. Mr. Chairman, we need more doctors, we need more nurses, we need the other health professionals and paramedicals without whom quality services would not be possible. We should demand an increased budgetary allocation for health to train more doctors, nurses, and other health professionals. We should demand adequate infrastructure and modern equipment to support health service delivery. We need a constant and reliable supply of drugs and other commodities to reach all Ghanaians. Mr. Chairman, ladies and gentlemen, it is said that those who anticipate and prepare for change will often lead it. We can no longer afford to stand on the sidelines. The choice of the topic for our session today, in my estimation, is an excellent one. It is my hope that the discussion here will ginger us to get more involved in healthcare delivery in Ghana. We must lobby, even pressurize our government into playing its rightful role in providing good quality health service. And to quote my former teacher and mentor, Professor Fred Tsai, we must advocate with fire in our bellies for quality health care for all Ghanaians, wherever they may be in this country. And in health, more than anything else, we can truly aim at black, white, and heart. We, the people, have to take up the fight. I'm very convinced that an association that can boast of so many brilliant brains and movers and shakers can take the lead in this initiative. So it's a challenge to us. I would like to end with a quote from Anthony Robbins from his book, Awaken the Giant. He said, and I quote, "The history of the world is simply the chronicle of ordinary people who had extraordinary levels of commitment to making a difference. These individuals decided that something must change, that they must be the ones to do it. And then they summoned the courage to persist until they found a way to make it work. And their only limit was their imagination and commitment." And then he goes on to say, "For while there's a lower class, we are in it. While the sick die, when there is a cure, we have no security in living." I thank you for your kind attention.